All right, good morning. My name is Jay Alexander Dix, and I'm a third-year pharmacy student. I'd like to start by saying that the opinions I'm sharing are my own and do not reflect Northeast Ohio Medical University, the student body, or the pharmacy profession. I would like to address the use of cannabis in the medical community and patient safety. It is being used for an increasing number of conditions and generating interest in furthering its approval, but there are still considerations that need to be undertaken to ensure that any use is done safely. Cannabis, like many drugs, may be dangerous if used incorrectly. It has been reported to cause unpleasant side effects including anxiety, paranoia, low blood pressure, increased heart rate, nausea, and blurred vision. To date, the FDA has approved over 1,400 drugs, many of which have similar and in some cases much worse side effect profiles. There have been limited controlled trials to fully describe the tolerability profile of cannabis. Additional experience can add to this knowledge base, allowing healthcare professionals to assist their patients by weighing the possible benefits and risks of using this product. When considering treatment options, it is essential to evaluate the potential benefit that patients may receive. A number of recent studies have shown that cannabis can be an effective therapy for several diseases including glaucoma, pain, and epilepsy, among others. In many cases, there is conflicting evidence of the true impact of this compound in determining the full effect. An example of the conflicting data can be found in the evidence available for cannabis use for gastrointestinal or gut disorders. A Canadian study, published in Inflammatory Bowel Disease in 2014, showed cannabis improved abdominal pain in 83.9% of patients for inflammatory bowel disease, a potentially debilitating disease that can dramatically influence a patient's quality of life. But for patients with Crohn's disease, another gut disorder, use of cannabis increased the likelihood that patients would require surgical intervention. To further muddy the waters, another trial published in Clinical Gastroenterology and Hepatology in 2013 included a small study of Crohn's disease patients who found that cannabis treatment resulted in complete remission of symptoms in over half the participants, meaning their symptoms were completely resolved. How can this be? Cannabis is beautifully diverse. There are a number of active compounds within the plant, the most well-known being tetrahydrocannabinol and cannabidiol. Another group of compounds are terpenoids, aromatic compounds that give the plant its distinct smell and flavor. These are common throughout many other plant species, including pine trees, lavender, and lemons. These chemicals provide sedative, analgesic, and anti-inflammatory effects. Each strain has different amounts of these compounds, making one an appropriate therapy for disease A, while potentially causing harm for a patient with disease B. Perhaps that is the reason for the different results in the studies just mentioned. Further research must be done to fully comprehend these distinctions. Cannabis is processed in the liver, similar to many other medications. This opens the door for potential drug interactions where the amount of chemical or drug processed by the body may be more or less than what is expected, leading to concentrations that are too low to be effective or those that are too high and result in toxicity. This implies that cannabis can affect the body's response to medications and supplements. Little is known about the specifics of these interactions, but the outcome may be potentially dangerous. Patient safety is number one when it comes to drugs. I propose a model where a pharmacist or other licensed professional dispenses cannabis from behind the counter, just as pseudoephedrine is. This way, the patient will receive the exact strain meant for their therapy and is counseled every time about possible interactions with concurrent medications. This also allows patients to ask any questions they may have for the drug expert, rather than from the drug dealer or those who run the dispensaries. It must be regulated, it must be consistent, and we must ensure each patient is educated accordingly. How many patients are already using an inadequate or inappropriate strain of cannabis? The recent amendment that failed to pass made almost no effort to create a medical model that benefits the patients more than the recreational user. With Ohio having such prominent health systems, especially right here in Cleveland, it is absolutely necessary to draft comprehensive legislation. Please consider the patients and how we as professionals can further assist their therapy. Instead of just being the 24th state to legalize medical marijuana, let's also be the first state to ensure patient safety. Thank you.
When you take your classes, do we ever discuss this in our schools?
I would say less than 1% of the material we go over is about medical marijuana. I would like to see more of it,
So would I.
personally.
So would I. Thank you.
Thank you.